Here's something pretty sobering to think about. Medical error is actually the third leading cause of death in the U.S.
Yeah, it's a shocking statistic.
And what's maybe even more striking, over a quarter of those errors, they stem from how doctors actually think their clinical reasoning skills.
Exactly, which is why it's so important.
So let's dive into this because today on the deep dive, we're exploring how medical professionals, especially, early in their training, how they learn to think critically and make those really crucial diagnoses.
Absolutely. And we've got two really compelling sources today that sort of shine a light on this whole process. First up, we're looking at a research article. It's a scoping review.
Okay, a scooping review.
Yeah, basically a broad survey of the existing research. This one looks specifically at how clinical reasoning is taught during the preclinical years of medical school.
So the very beginning, really.
Pretty much. Think of it like taking a step back to see the whole landscape of how these fundamental skills are being developed.
Okay, and the second source.
That one offers a really different angle. It's a deeply personal perspective, an essay from a medical student.
Ah, okay.
And it reflects on the complexities of actually connecting with patients. Those moments where understanding a patient goes way beyond just figuring out the diagnosis.
Right, understanding the person, not just the illness.
Precisely. It's about grasping their individual experience.
So, for you listening, especially if you're keen on gaining knowledge efficiently, getting to the heart of things, this deep dive should offer a pretty unique glimpse into a really foundational part of medical training and ultimately patient care.
Yeah, we're aiming for those sort of aha moments, really, as we unpack how future doctors learn to connect the dots, both analytically and humanly.
Okay, so this scoping review you mentioned first, it casts a wide net looking at how clinical reasoning is taught early on. What did they find out about how clinical reasoning itself is even, defined in these programs? Is there agreement?
Well, that's actually one of the first really interesting things, the lack of a consistent definition. It's kind of surprising.
Really? No standard definition?
Not really. The researchers point out that another broader review found, get this, over 110 different definitions floating around for terms related to clinical reasoning.
110. Wow.
Yeah. And even within the specific curricula this review looked at, only a small fraction actually spelled out what they meant by clinical reasoning.
Huh. That seems problematic.
Think about it, over 100 ways to define something so fundamental. That lack of a shared understanding probably makes it incredibly hard to compare different teaching methods, or even know if everyone's talking about the same thing.
Yeah, you'd think that would be step one, right? Define the thing you're teaching.
You would think.
So with all that variety, what definition did this particular review end up using just to try and keep things focused?
Right, they needed something. They used a definition that describes clinical reasoning as the process of observing, collecting, analyzing, and interpreting patient information to arrive at a diagnosis and management plan.
Okay, that sounds pretty comprehensive. Covers the key steps.
It does. It breaks down that core process from patient details to a plan of action. It's also worth noting that these curriculas used all sorts of different terms for this same basic process, like critical thinking or diagnostic reasoning, or sometimes just problem solving.
Okay, that makes sense. Different labels for maybe similar ideas. Now, when it comes to actually teaching it, were these curricula built on specific educational theories, or was it more just practical, maybe ad hoc?
That's a really good question. And the answer was, again, kind of surprising. The review found that only about 1/3 of the curricula they looked at explicitly mentioned the educational theory framework, that foundation for designing effective teaching strategies.
It's like building a house without a blueprint, maybe.
That's a great analogy.
Yeah.
Yeah, you might end up with something that stands up, but it's probably not going to be as strong or as well designed as something built with a clear plan based on, proven principles.
So for that third that did mention a theory, what kinds of ideas were they drawing on? Any common ones?
Yeah, there were a few recurring themes. Dual process theory was one.
Dual process. That's the fast and slow thinking idea, right? Intuitive versus analytical.
Exactly, like, quickly recognizing a pattern versus methodically working through possibilities. Clinical reasoning really needs both. Then there was encapsulation theory, how knowledge gets more organized and easier to access with experience.
Oh, okay.
And illness script theory came up too. That focuses on how doctors build these sort of mental models or scripts for different diseases.
Like a template for a condition.
Kind of, yeah.
Yeah.
And they also mentioned things like guided inquiry and the discovery model of learning. So a mix, but again, only in about a third of cases.
Still quite a range, even within that minority. Now, the review also talks about clinical reasoning domains. What exactly are those? Are they like different parts of the skill?
Yeah, you can think of them as the specific skill sets that make up the whole process. The review identified domains like information gathering,
So asking questions, doing the exam.
right, and then hypothesis generation,
Mm.
coming up with potential diagnoses, then creating a differential diagnosis.
The list of possibilities.
Exactly, ranking them, essentially. And finally, diagnostic justification, being able to explain why you arrived at a particular diagnosis.
Okay, got it. So which of these domains, these skill sets, were most commonly taught in the preclinical years?
Well, the review found that information gathering, hypothesis generation, and differential diagnosis were the ones covered most often.
Okay, the core diagnostic steps, it sounds like.
Pretty much. But what was interesting was that domains like considering environmental and social influences on a patient's health,
Mm.
those were less commonly addressed.
That is interesting, especially now with all the focus on social determinants of health. You'd think that would be woven in earlier.
That's a really valid point. The researchers suggest maybe it reflects the sort of progressive development, introduce these broader factors later on.
Mm-hmm.
But yeah, it also highlights a potential gap in that really early education, focusing maybe more heavily on the purely biological side first.
Okay, so we know what they're generally teaching. How are they actually teaching it? What methods are these preclinical programs using?
The most common methods were things like small group sessions, usually with the preceptor and experienced clinician guiding them.
Right, learning from someone who's done it.
Exactly. Case-based learning was also really frequent. So working through real or simulated patient scenarios.
Makes sense. Practice makes perfect, sort of.
Kind of. Then you had your large group lectures, of course, and also asynchronous individual work, things like online modules or reading students do on their own time.
So a mix of approaches, really.
Yeah, most programs used multiple methods, which is probably good.
Did the review give any sense of which methods actually worked best? Was there any comparison?
Well, that's a key point the review flagged as a limitation. Because most curricula used a combination of methods, it's really hard to isolate the effect of any single one.
Right, you can't tell what's doing the heavy lifting.
Precisely. And on top of that, the research they analyzed often had pretty limited evaluation of how effective these different teaching methods actually were.
So we have an idea of how they're teaching, but maybe not so much clarity on whether students are truly learning and improving their reasoning skills from it. How were learning outcomes assessed?
Well, outcomes were reported in most of the curricula reviewed, but the main focus tended to be on initial reactions.
Like, did the students like the
Right.
session?
Yeah, student satisfaction, that kind of thing.
Mm.
And basic learning, like could they recall information? They used a framework called Kirkpatrick's levels.
Oh, yeah, I've heard of that. Levels of evaluation.
Right, so level 1 is reaction, did they like it?
Right.
Level 2 is learning, did they absorb the info?
Mm.
Most of the reported outcomes were stuck at those lower levels.
But not so much at the higher levels. Like, did it change their actual behavior or impact patients down the line?
Exactly. Those crucial levels, level 3, behavior change, and level 4, results like patient outcomes, were assessed much less frequently.
So mostly checking if the information went in, but not necessarily if it changed how they think or practice.
That's a fair summary.
Mm-hmm.
And even when formal assessments were used, only a few provided evidence for their validity.
Validity meaning whether the test actually measures clinical reasoning accurately.
Correct. Whether it's truly measuring what it claims to measure. So lots of activity, but maybe not enough solid proof of effectiveness or deep learning.
This all seems to point towards, well, a need for more rigor, more clarity in how this crucial skill is taught and checked, which brings us to the review's recommendations, right?
Exactly. Based on everything they found, the authors laid out 5 key recommendations for educators reporting on their clinical reasoning curricula.
Okay, what are they?
First, and maybe unsurprisingly given our earlier chat, they stress explicitly defining what they mean by clinical reasoning in their reports. Get on the same page.
Makes sense. Number 2.
Second, clearly state the underlying educational theories that guided how they designed the curriculum. Show the blueprint.
Right, the why behind the how, okay.
Third, they said educators need to clearly identify which specific clinical reasoning domains, like information gathering, hypothesis generation, are being addressed.
Be specific about the skills targeted. Got it.
Fourth, and this relates to assessment, They urged programs to provide any evidence they have to support the validity of their assessment methods, show that your tests actually work.
Crucial. And the last one.
And finally, they recommended describing how the specific curriculum fits into the bigger picture, the broader context of clinical reasoning education at that particular institution. Show how it connects.
Those all sound like really practical, important steps. It's about better communication, better design, better research in medical education itself, really.
Absolutely. More transparency, more systematic approaches. Now, this feels like a good moment to shift gears slightly and bring in that personal essay, Pink Toenails on a Tuesday.
Right. The student's perspective. How does this more human-centered story connect with the findings from the big review?
Well, it provides this really powerful real-world contrast, but also a complement, I think, to the more structural findings we've been discussing.
Okay.
It recounts a medical student's interaction with a young patient. And what's so striking is how much of their connection, their interaction, goes beyond the purely diagnostic stuff that the formal curricula often focus on.
The title alone, Pink Toenails on a Tuesday, makes you curious. What's the story there?
Well, that small detail, noticing the patient's pink toenails, it became this unexpected, crucial point of connection for the student on a human level.
Ah.
It wasn't about gathering medical data in that moment. It was about seeing the patient as an individual, someone beyond her diagnosis.
And that connects back to what the review found.
Exactly. It resonates so strongly with the review finding that those social influences or the broader context were among the least commonly addressed domains in formal teaching.
Yeah, it's that vital reminder, isn't it? Patients aren't just puzzles to be solved. They have lives, feelings, experiences.
Totally. All of which profoundly shape their health and how they experience illness. And there's this pivotal moment in the essay.
Oh, yeah.
The patient asks the student about the purpose of her suffering. A really deep, difficult question.
Yeah.
And the student honestly replies, I don't know.
Wow. That takes courage.
It really does. And that honesty, that acknowledgement of the limits of medical knowledge, it's a powerful example of metacognition, being aware of your own thinking and its boundaries.
Which is part of good clinical reasoning, right? Knowing what you don't know.
Absolutely.
Yeah.
But it's not always explicitly taught or, frankly, encouraged in the same way as knowing the answers. And interestingly, in the essay, that vulnerability,
Yeah.
it actually built trust.
That seems counterintuitive, maybe. You'd think admitting uncertainty might undermine confidence.
You might think so, but here it fostered connection.
Mm-hmm.
And the student's later gesture, actually painting the patient's toenails.
Ah, bringing it full circle.
Yeah. It symbolized this commitment to just be there to support the patient beyond just the medical treatments. It really touches on that environmental, emotional context of care.
Again, areas the review suggested get less focus in formal teaching.
Precisely. So while the formal curricula might be, heavily weighted towards hypothesis generation, differential diagnosis, all that, this essay just beautifully highlights the absolute necessity of empathy, communication, and acknowledging the messiness of life in actual patient care.
So the art of medicine complementing the science.
That's a great way to put it. The essay really illustrates how understanding the patient's perspective, building that rapport, addressing their emotional needs, these are integral parts of being a good doctor, even if they aren't always line items in a preclinical syllabus.
It suggests that truly effective clinical reasoning has to encompass both, doesn't it? The analytical rigor and these vital human elements.
I think that's exactly right. It's a powerful reminder that while the scientific foundation is non-negotiable, that art of connecting with patients, human to human, is just as critical for providing truly good care.
Yeah. You need both sides of the coin.
Indeed. The scoping review gives us that wide-angle lens on how future doctors are learning the thinking part, diagnostically. And the essay gives us this essential close-up on the human dimensions of that thinking out there in the real world. You need both perspectives.
Okay, so wrapping things up a bit, we've seen there's quite a bit of diversity in how clinical reasoning is taught early on, often without maybe a clear shared language or theoretical grounding. We saw the emphasis often falls on core diagnostic skills with maybe less explicit focus on broader context, social factors, and a need for better, more validated assessment methods.
Right, and stronger reporting overall.
And then that really moving essay reminds us that underneath all the structured reasoning, there's this fundamental human connection, the ability to really see and support the patient as a person.
That sums it up nicely. You've got the formal structures under the microscope in the research, and then the indispensable human element brought to life so vividly in the personal story. Both absolutely vital pieces in training doctors who are not just competent, but also compassionate.
So here's a final thought for you listening. As you think about how professionals in, well, any field develop their critical thinking and decision-making skills, do you see parallels with these challenges and approaches in medicine?
Yeah, and how might that emphasis we discussed on both structured reasoning and genuine human connection lead to better outcomes? Not just in healthcare, but maybe in other complex areas too.
Definitely something worth pondering. Think about the importance of clear communication, clear principles in any field needing complex thought.
Absolutely. Maybe think about times in your own work or life where you've seen that interplay, where both sharp analysis and real human understanding were essential.
Well, thanks for joining us for this deep dive.
Yeah, thanks for listening.
Until our next exploration.